is that there's some evidence that they can be therapeutically useful, and not just useful, but useful in ways that overcome a lot of the shortcomings that a lot of traditional psychiatric medications have. There's evidence that you can just give a small number of doses to see remission of things like PTSD, that you don't need to keep taking it chronically for months and years at a time. So they're fast acting in that sense. They also have the effect or the side effect, depending on your perspective, of they induce subjective effects, hallucinations in the case of classical psychedelics, the stimulant and prosocial effects in the case of MDMA, the dissociative effects for things like ketamine. And there's some debate right now in the field in terms of whether or not the subjective effects are just epiphenomenal or they're required for the therapeutic benefit. Based on your whole career in synaptic plasticity and experience dependent plasticity, how do you think about this?
I think that is perhaps the critical question in the whole field of psychedelic research, and in the context of using these drugs as therapeutic agents. Everybody in the field wants to know the answer to that question. My personal intuition is that it's going to be very difficult, if not impossible, but it's a personal opinion, not based on real data, to dissociate the subjective experience in response to these drugs from their therapeutic efficacy. That doesn't mean, so I really believe, and it's a little tricky. Do you need the trip for the therapeutic efficacy, or is it you can't dissociate them, but you actually don't need the trip? But